have diabetes. Over 20% of inpatients at Guy's and St. Thomas's have diabetes. Half of us are on insulin. Most of us are admitted for reasons other than diabetes. Our outcomes are worse compared to other patients. We have double the risk of wound infection, of readmission into hospital, double the length of stay, and increased mortality. Here at Guy's and St. Thomas's, we could do better. People with diabetes experience more medication errors and poorer overall diabetes control than at other hospitals. Whenever they test my blood glucose, ward staff tend not to act when the level is high. It worries me because I know this leads to poorer outcomes. The staff at this hospital have been working on something that might just be the solution. The Think Glucose Toolkit is a new way of managing inpatients with diabetes. The new blood glucose monitoring chart and guidelines give staff the decision-making tools they need to assess and treat me in the right way. Let's use my case to go through the chart and guidelines. I've been admitted with a chest infection. According to the triage guidelines, I do not meet any of the criteria for referral to the diabetes team. So staff on the ward now need to identify my blood glucose target range. I should be on the standard range, which is appropriate for most patients, 4 to 11 millimoles per litre. Staff should document my target range on the blood glucose chart by simply ticking the relevant box. When my blood glucose is tested and the result is within this range, record it in the white box. If my result is above or below the range, document it in the red box. I use insulin. My blood glucose should be tested before meals and before bed. And the frequency of monitoring should be documented on the chart. Now, let's take a look at the type of insulin I'm on. Many of the insulin names sound similar and can be easily confused. I use Humalog Mix 50. This is a mixed insulin with both short-acting and long-acting insulin. The usual timing of my dose is twice daily. Checking that my insulin brand has been prescribed for the number of doses per day, as described in this table, is an easy way to prevent mistakes. But always double check with the patient and another member of staff if you're not sure. I have now been on the ward for 1 day. The team can see 2 results in the red boxes within 48 hours. Both are above my target range. Therefore, staff should act to get my glucoses back to my target range using the action pathway for patients with hyperglycemia, which indicates that insulin correction doses need to be prescribed. Use the table at the bottom of the guideline to decide how much insulin to give. If I have been given more than 2 correction doses in 1 day, staff should refer back to the action pathway guideline to find another solution to my high blood glucose levels. This guideline shows that my regular insulin doses should be adjusted and describes how to calculate the dose increase. Then refer me to the inpatient diabetes team, and remember not to change my dose by more than 6 units without contacting the diabetes team. Sam also has diabetes. He has been admitted because of difficulty in breathing. Sam's diabetes is usually well controlled with metformin. Sam's target is 4 to 11. And because he's on tablets for his diabetes, his blood glucose should be tested pre-breakfast and pre-evening meal. Sam has been prescribed prednisolone, which is a steroid. He should have another blood glucose test 2 hours after lunch. On his first day on the ward, Sam has 2 blood glucose test results that are above his target range. The likely cause of this is the steroids. Staff should therefore refer to the management of hyperglycemia secondary to corticosteroids guideline. We can see that in Sam's case, Insulatard once each morning should be prescribed according to the table. By Sam's 4th day in hospital, he is feeling much better and his blood glucose is within range. The insulin was stopped on the same day as his steroids. The next time you have a patient with diabetes, remember to decide and document clearly a blood glucose target range, the frequency of monitoring, and always refer to the Think Glucose guidelines when we have 2 readings or more above our target range within 48 hours. This toolkit has been shown to improve the care of people with diabetes at Guy's and St. Thomas's. By using it, you can ensure that we receive the high quality of care that we deserve. Think Glucose inpatient care for people with diabetes.